We're going to be speaking about pediatric rhinitis, really the nature of it, the presentation and its treatment. And what we're talking about here is children who present with chronic or intermittent nasal discharge and congestion. This is a real passion of mine. You asked me, why do we need to involve pharmacists and other healthcare workers in this condition? Is that unfortunately, I think the way we manage recurrent or persistent childhood respiratory events is really a blight on modern medicine development. If children are presented to a GP with chronic discharge from their nose or intermittent discharge and congestion, they're often treated with antibiotics. And for most of these children, the process is not bacterial. It's an inflammatory event, a viral event, or some response to the environment, and treating it along those lines is what's important. And I think it's very unfortunate that our modern medical development has ended up prescribing so many antibiotics to these children. Unfortunately, for most patients, antibiotics are not the solution here. And in fact, I believe that they should really not be prescribed for children who get recurrent respiratory events. Over-the-counter medications now, such as corticosteroid sprays and antihistamines, are really the sort of medicines which should be used just to suppress the inflammatory reaction that occurs in most children who have recurrent respiratory events. Antibiotics are absorbed systemically and end up having a whole lot of adverse effects, I think, long-term to the developing body. So pharmacists are critical in this whole process because they're available OTC. Patient interactions with doctors often drive the antibiotic prescription process, and so the pharmacy profession really provide an in-between where we can help change this behaviour in our community. Patients and parents often drive the antibiotic prescription process for children who have just recurrent respiratory events and rhinitis. And I think there's a patient-driven process there that the pharmacy profession can help change. I think the expectations between the patient and the pharmacist is different, and it gives pharmacists an opportunity here to change this behaviour in our community.